The following program is brought to you by the League of Women Voters.
Good morning, ladies and gentlemen. Welcome to the League of Women Voters New Britain Area Legislative Forum for 2019. This is one of our favorite meetings because it is very issues-oriented. It's a fairly free-flowing discussion of what is going to be happening in the Connecticut legislature this year. The League of Women Voters is a nonpartisan but political organization of men and women who like to make a difference. We study issues, we take stands on issues, we never endorse candidates, we bring information to the public as best we can, and we would welcome your joining us anytime you'd like. This morning we have here presently 3 people from the legislature, 1 person who is actually moving from the legislature to Governor Lamont's campaign, and we're expecting Mr. Terziak as well. So, we're going to begin asking each of the people on our panel if you would please give us a little statement of what your job is, what your committees are, what do you hope to achieve this year, what are the things that really worry you, and maybe what are the things that make you hopeful. So, the microphone is closest to you. Mrs. Giarratano, would you like to start and explain your new job and what your hopes are for that?
Thank you. Thank you very much. I thank the League of Women Voters for this opportunity to talk a little bit about what I will be doing outside the legislature. I know it says 6th Senate District there. I am no longer state senator. Last week I was, but this week I am not. I did not take the oath on Wednesday, January 9th. And instead was appointed by the governor to the Office of Health Strategy as a senior advisor. Healthcare has always been an ongoing interest to me. This is a wonderful, wonderful opportunity for me to work with an entity that actually looks at healthcare policy in our state, as well as, and it's informed, it's information that comes from very informed, specific areas of the Office of Health Strategy. We work on what is commonly known as evidence-based and data-driven. We actually have data analysts in the Office of Health Strategy that look at best ways to not just develop policy, but how can we make a difference in people's lives and their healthcare decisions, and where there may be healthcare disparities in our communities. There's many, many ways for us to be very effective. Let's go back just a little bit. Actually, in 2017, in the June special election, I worked on and passed legislation that would organize a number of different components of our state government that were dealing with health into one umbrella organization, which is now the Office of Health Strategy. At that time, we had 5 or 6 different areas that were all focusing on what are we going to do about healthcare? How can we deliver the best quality healthcare in our state? How can we keep it cost effective, utilizing cost containment strategies? And, most importantly, of course, where should Connecticut be going in the 21st century? So that's why it's very exciting to me. It's a little bit wonky. Yeah, that's true. Absolutely. And I have to come up to the speed that the current people, the executive director, Vicki Veltri, and the members and leadership of the OHS, what they are working on, and of course, to understand how OHS is actually functioning now. The different components, I started to say a little bit, and I could go on, Ian, so I don't want to take up too much time. But we have the state innovation model. State innovation model came out of the Affordable Care Act in 2010, 2011 in Connecticut. It was applied for a grant to be able to, through the Centers for Medicaid and Medicare Services Innovation, to look at, as I said, health policy in our state and how best to help our communities, as I've also said. There's also the Office of Health Information and Technology. We have been working on, and we'd like to develop a portal, one portal in the state where patients can access their medical records. This has been done in other states. And in doing so, it also means no matter where you go in the state, and no matter what health system, hospital, doctor, practitioner, health practitioner, your medical records will go with you. This is something that other states have developed. It's time for Connecticut to develop it also. There's also the Office of Healthcare Access. This is an entity that oversees our health systems, looks at the certificate of need area of our statutes, enacts it, promulgates it. I actually worked on that area as a legislator, did a whole overhaul on our CON, particularly when for-profit hospitals were coming into the state at that time. So my background in the legislature and working in this area, this is just a few of the functions, if you will, of OHS, really have come together in being able to, as someone who has overseen and developed a lot of this legislation and enacted it, this is a good chance for me in the executive branch now to see how it's promulgated and carried out. It's very exciting. Thank you so much.
Thank you very much. Thank you very much, Peter. Representative Terziak, if you would please introduce yourself. What committees are you on, and what are your priorities for the year?
Thank you very much. I'm sorry for being late. I'm fortunate enough to be on the same committees that I was last year, which I asked for. I'm on the Public Health Committee, I'm on the Appropriations Committee, and I'm on the Energy and Technology Committee. This year, I'm particularly excited about energy and technology. There's a group of us who want the state to do more to protect people in the new digital landscape. California has been making some strides with consumer rights, with user rights when it comes to technology. We should be doing it too. And that's basically what the new issue is. The other issues remain the same. New Britain needs more money. Rich people in Connecticut don't pay as much taxes as rich people in our neighboring states. And healthcare just keeps on changing and getting further and further away from a model that is based on a patient and their healthcare provider, whether that be a doctor or an APRN or whatever. So those are the issues. And I put in a ridiculous number of proposals for law. I'm not used to this. When I was a committee chair, I would say, no, I'm not putting in a proposal and I'm not signing on to yours because I have to get my committee bills through and I don't want to owe anybody any favors. I'm not a committee chair now. And what interests me? And so I paid attention these last couple of years, and when I've said or heard said, there ought to be a law, we'll see what we can do. Thank you very much.
May I ask Representative Pettit, if you would take the microphone? Thank you.
Thank you. Peter and I will see a lot of each other. I'm on the exact same committees, Public Health, Terry's old committee that she chaired, now chaired by Senator Abrams and again by Representative Steinberg now from Fairfield County. One of the big issues, again, coming out of Public Health will be concerning the opioid crisis. And I think the committee's prejudice is, again, to have a large bill because there's multiple small proposals about little pieces of the opioid crisis and trying to wrap it into to one bill. An interesting concept came up the other day at the EMS and Fire Caucus, talking about mobile health team. And essentially the short version is to try to get EMS providers more involved in the healthcare system, because a lot of the transport they do are people who just don't have an emergency but need a ride to the hospital and need some sort of chronic ongoing care, adjustment of medication and the like, to try to number one, provide better care, and number two, cut healthcare costs as they continue to climb. So that's going to be a busy committee with many issues. We've already had a couple of meetings and screened 70 to 100 bills already. Secondly, we're both on appropriations, and we've had an organizational meeting, so we presumably have our work cut out with us, and we haven't been buried with the numbers yet. That's soon to happen when the numbers are unleashed upon us. So I don't have many concrete comments there, other than we're dealing with a $2 to $4 billion deficit that we'll have to approach in a number of ways. And third is energy and technology, and I would agree with Peter that talking to a number of people on the committee, they're very interested in pushing some of the technology issues because they feel like a lot of the major energy issues may have settled a little bit in the past couple of sessions, and the technology in terms of privacy, 5G, bandwidth across the state, a number of other issues are going to take precedence. So that's where I am, and I think we're going to be both more busy than we wish we were.
And Representative Sanchez, may we hear from you, please?
Yes, thank you. Representative Bobby Sanchez, 25th District. I'm on the Education Committee. I'm actually the chair this year of the Education Committee. And I'm on the Higher Ed Committee and Finance and Bonding Committees. Same committees that I was on last year, but in education, big change because I'm the chair. And getting into education, people that know me know that my background has been in early childhood education. One of the things that has been disturbing to me in the state of Connecticut, and not just Connecticut, but nationally, is that teachers that serve our communities, and particularly in early ed, are not respected. And I'm talking about compensation. They're the lowest paid teachers in the country, and it's wrong, because if you go into a child care program and you look and see what these teachers do and how they have to record and how they have to do developmental screenings, it's a lot of work. And some of them are just at minimum wage, which it's really shameful. So that's something that I plan on working on really hard to help our communities. And this is not just a city issue. This is a statewide issue. The other thing is, in the state of Connecticut, and we're probably one of the few states out there that also has a problem with minority teacher recruitment. Trying to get minority teachers into the system. I can't understand why in the whole state of Connecticut we have about 6% that are minority teachers. And, last year, and I want to say this real quick, I had a lady who came from Puerto Rico, was at the Bridgeport school system working as a para, and this lady had a doctorate degree in education, could not get into the system because she needed to go back to school to take 2 courses and get certified in the state of Connecticut. That's absolutely wrong. And for people who don't know this, Puerto Rico is part of the United States. It's a commonwealth. And the schools in Puerto Rico are accredited by American institutions. So, that being said, I find it very hard that someone coming in from Puerto Rico cannot get a job in Connecticut as a teacher. I can understand if there's a language barrier, that can be worked on, but this lady who spoke to me spoke perfect English. So that's another issue that I would like to work on as well. The other thing is, on higher ed, we're talking about a forgiveness program, a loan forgiveness program. We know that so many of our students graduate from school with huge amounts of loans, and something's got to give. I have a son who just graduated last December from CCSU. He has loans, and he's trying to get a job. That's the other thing. You know, we have to talk more about jobs, too, job creation here in the state of Connecticut. And his background is in microbiology, so go figure, he's having a hard time getting a job. But we need to really focus on how we can help our students with these forgiveness, loan forgiveness programs. And this also goes back to some of the early child care teachers who are being mandated by the state of Connecticut now to get their bachelor's degrees. There is a mandate right now where by 2025, all these teachers have to have their bachelor's degrees. So that's another issue. So I could go on and go on and go on education, but I'm going to pass it to my colleague here.
Okay, Mr. Lopes, Representative Lopes, your turn.
Hi. Thank you all for coming. Rick Lopes, 24th House District, which represents the southern third of New Britain and a little bit of Newington. I've been in the legislature since 2012. A lot of duplication with my colleagues here going last, but I'm on the Energy Committee with my two colleagues over here. A lot of interesting stuff is going to be going on, happening there. And with Bobby and the Education Committee, we've said for many years the most pressing issue in New Britain has always been education parity. We need to have a better education system that's more in line with our neighboring towns if we want to have families come here, stay here, live here, and make a vibrant community. So that's always been a number one issue for New Britain. Personal issues I want to work on this year is I'm one of the few small business owners in the legislature, and I'm working with people in the General Law Committee who on bills for protecting small business owners. One that's prevalent this year is like small engine repair, lawnmower, snowblower repair companies are really bound up with contracts they have to make with large corporations that make the equipment that sometimes puts them at a disadvantage. And we're trying to work that out in an amicable way where, we're not forcing anything down anyone's throat, but trying to make a compromise between the two to make sure these small business owners get protection and not fixing things under warranty for free, which is a lot of them end up doing. I also want to work on our small nonprofits, which in this state are primary caregivers to a lot of people. We do a lot of health care and mental health care through our nonprofits. Substance abuse care related to the opioid issue are all done through small nonprofits, and they've been pinched for the last 10 years. Their finances are in disarray. They're really hurting. Services are therefore coming down. We need to work on that and improve those services there. And lastly, and maybe most relevant for New Britain, is environmental issues. Over the last couple of years, we've had the issue with the Tilcon water issue. I think it's very important that we stand up and protect our water rights and make sure we don't sell them and make sure that we preserve fresh, clean water and watershed land for many generations to come. We have a lot of strong laws on the books, but there's a lot of interest from private companies coming in and buying our water rights and using it to sell water. We lose those rights, and we can't do that because we really don't know what the future brings, and water is becoming more and more important every year. So that's it.
Well, thank you for your introductory statements. A bit of housekeeping information. We now move on to our part of the meeting where you get to ask questions. And I'm asking that your questions be about state issues, not federal, not city, but state issues, things that the legislature will take up, and that they be brief questions to the point. Are we going to run around a microphone, or I can repeat questions into the microphone so that it goes onto the TV tape? Okay. Why don't you give Mariola the portable, and I'll bring this over to the table. And if people decide that they are making statements, which tends to happen, even when you say questions, statements tend to wander in. I probably will keep them to a minute or two to keep them short. So, I see a couple of hands going up, and why don't I start way in the back of the room in a blue sweater, please?
Hi. I have to start with a statement. This is the League of Women Voter and not one female elected official. Well, No, she's not going to be a senator anymore, is what she said. So,
You're
so
right.
actually,
May
I
we
would
have your
like to.
question?
Yes, I do have a question for her. I feel that with the opioid epidemic, some states are going after the pharmaceutical companies, and I strongly feel that the state of Connecticut needs to go after the doctors as well. I personally had a very small oral surgery and got a prescription for 20 oxycodone, which I chose not to take. The doctor insisted that I fill it and throw it out later. I think that I would like to know if there's any way that the state of Connecticut can go and look at the prescriptions that opioid prescriptions that doctors have prescribed, in my personal opinion, outrageous, and do something about that.
Thank you for the, there you go. Thank you for the question. Sorry, I wasn't sure whether it was on or not. I can speak about my past work, certainly in the legislature as co-chair of Public Health Committee. We have, first of all, a very strong and robust PDMP, Prescription Drug Monitoring Program in the state. And over the last 7 years, we have increase the ability to monitor and track the use of prescription medications, opioids, in our state. There is compliance on the part of any practitioner who prescribes these kinds of medicines. That compliance is that by the end of the day, they have to let the state know who they have written prescriptions for. These are tracked. We've eliminated a lot of the problems that we have had in the past, the over-prescribing, because now we track it, and also the fact that we didn't know who was getting what and where and when. So that, I believe, has gone a long way in helping to curtail and keep down the over-prescribing, if you will, of opioids in our state.
So after these doctors, they keep prescribing, just because you oversee how much prescriptions they write, we have an opioid epidemic here. I mean, why would somebody with a small oral surgery be encouraged by the doctor
It's okay.
to fill the prescription, which I didn't even want to, and I ended up giving it to the police?
Right, which you can also do, and we actually have a place here in the city, in the police department, where you can give your unused
Go after
medications.
the doctors. I want you to sue them. I don't want you just to look at what they're doing, because looking doesn't do anything.
No, but tracking does.
Tracking doesn't do anything. We have an opioid epidemic. Go after them, just like people are going after, because it costs me as a taxpayer money to take care of these people that are addicted.
Well, what I can say, rather than talking about what we have done, and I think we've done quite a bit, in regulating prescribers like doctors, APRNs, physician assistants.
Go after them. I cannot be more clear. This as a
No, I understand exactly what you're saying,
very disturbing
but
to me.
if you'll let me finish, Representative Pettit and I know Representative Terziak are both on Public Health Committee. I believe Representative Pettit mentioned that there were a number of proposals this year. Bill, I don't want to put you on the spot, but maybe you can talk a little bit about if any of those proposals address prescribers or anything along that line, or what the state legislature thinks that they may be doing. That might be a little bit more helpful.
A conflict of interest, considering the fact that he used to be a doctor. I don't even understand why he's on that committee.
Well,
Okay.
Right, but he also
Right.
has doctor friends that he won't.
Ma'am, thank you. I think your question on the opioid crisis is extremely important. The question of regulation of doctors over prescribing is important. I'd like to hear those addressed very briefly by anybody else on the committee who would like to speak on the panel. Does anyone wish the microphone? And then after that, we'll try another question too.
Just that patients have you all have the right to fill or not fill. I recently had a surgery and was offered a prescription and said, I don't think I'm going to need it, and use Tylenol and Advil. So you always have the ability to refuse to say no and not take the prescription. Some places now, some health systems have put in place contracts for that reason, saying you agree to use this properly, we're going to give you X amount, and there's a discussion. Not all, but some. I've heard of some of the groups at Yale are doing it. There are suggestions for limitations of initial prescriptions, especially for acute pain. You also have to be aware that I receive a fair amount of calls from people with chronic pain who feel the pendulum swinging the other way, who've been on X amount of medication for many years, and now people are trying to limit them, and I get calls that they're in pain and can't get adequate pain relief. So I think it has to still be available, but done in a safe and reasonable manner. And I agree, there's still some folks out there that prescribe too many pills for acute pain when non-opioid therapies, and we've got some bills that have been submitted on non-opioid therapies to try to help this issue. Peter, did you have any comments?
A few. I'm sorry, I was texting and trying to find out how much opiate prescribing has gone down for Hartford Healthcare in the past year. Is it like 40% or is it just over 50%? It's a reasonably big number. As long as we're talking about personal histories. Within the last year, I had oral surgery. I think I was prescribed 15 tablets of whatever the opiate was on a Friday. And when I went back to see the dentist on Monday, I told him I was going to switch dentists. How dare he send me home with so little pain medication, that I had taken it all. I had taken it with aspirin. I had taken it with Motrin. I had taken it with everything I could think of, and I was dying. How dare he? He reminded me that he had given me his phone number, both in a form and wrote it on a piece of paper, and told me to call him. But again, I don't remember that particularly. I was coming out of anesthesia. Everything is different. I have always been confused why doctors don't get more attention paid to them in this crisis, because not so much the overprescribing, but it doesn't seem the most exotic issue that somebody taking their meds correctly finds that it's more than just about the pain. I can't think of any other condition where you can have a problem that comes up, let alone as serious as I seem to be addicted now, and it's not part of your health care issue with your doctor. I don't know why, all these years later, we have never had a conversation about doctors tapering patients off of opiates the same way they do with steroids. How many lives? About prison or not, I don't care. I want to see something done that makes a difference, and if prison is what makes a difference, we should be in fine shape. The #1 prescriber in Connecticut was an APRN. I believe she's going to prison. I know she's not an APRN anymore. We have no shortage of doctors and APRNs who have been prosecuted for overprescribing. Connecticut does pretty well per capita on how we as the state and we as Get the Feds In are doing about physicians overprescribing. Excuse me? Department of Public Health.
Let's take a minute to switch our topic so that we cover a breadth of topics, and if need be, we may come back at the end. Okay, I'll bring you a microphone.
Okay, good morning, everyone. My name is Jessica Lewis. I am a nurse and an educator. I work for Capital Community College, teaching the CNA program there. They rock. They do so much for these folks. I became interested in something that from out of state. My younger brother lives in Tennessee, and I don't know the details of it, but it might be something worth studying, that they receive a lot of funds from the lottery to provide scholarships for free community college. That will help us with loans So these folks won't be having loans. We need to support our community colleges and definitely our early childhood educators. They do an amazing job and they don't make much money. New Britain school system, while it has its issues, I've done some subbing for them. They do a lot for those kids. As a school nurse, I see a lot of things out there. There's a school in East Hartford, Woodlake. It's for behavioral kids, and it would be also a great model to follow. But I really would be like to see the Tennessee Promise kind of thing come to Connecticut. Promise, make it the Connecticut Promise. Thank you.
All right, so we're talking about funding. Go ahead,
my only
please.
comment would be, yesterday was another meeting of the Commission on Pensions led by Representative Steinberg, and they're talking about taking lottery money and using it to bolster up the pensions. The issue becomes if you take lottery funds that go into the general fund and are dispersed widely, take them, say, in this instance, and use it for community colleges, then you're taking money from some other part in the budget, so now you have to figure out how to fund. So it's not a bad idea, but you're sort of, in one sense, robbing Peter to pay Paul, which is exactly what the Pension Commission was discussing at the end of the day yesterday, that dedicating that fund stream there might be a reasonable idea to help the pensions, but then you're taking money, $10 million from here and $50 million from here, and so you have to figure out how to pay the other folks.
One of this morning's papers has an article about the state system for the colleges and community colleges and their pursuit of free tuition. Our goal is free tuition. It's not where the heck it comes from. I'm willing to spend more on free tuition than we get from any one funding source. In our state, we only have two funds. There's a general fund that covers everything except for transportation. And that's the other fund. We put in place what they call a lockbox, that once we say we're spending this money on transportation, that's it. But again, everything we do, it affects everything else. And we have to pay attention to that and remember our real goals. I don't want to be fighting over where the money comes from. I like to tell people that there are, in fact, tax and spend Democrats, but I'm just a spend Democrat. I see problems where if we spent money wisely, we could solve them and make a good difference. And tuition's a fine example of that. Thanks for what you do with the community college. That's where I graduated from nursing school 35 years ago, and they were excellent then, and they still are. Thank you for all you're doing there.
You know what? It's just been the best. It's been one of the best experiences I've ever had. My best thing is when these students text me that they got a job. We start people on the road to getting into the nursing program. They're out there getting jobs, making probably more than they would make. And I'm liking seeing all these medical people and education people here.
Okay, as long as I'm standing over here, let me just move here.
Actually, and this is back to the medical thing, but I would beg you to consider expanding the categories for pain medication for medical marijuana. I had total knee surgery 2 weeks ago, and the doctor kept saying, you really need to take fentanyl, and I don't want to. And so I've been suffering through with tramadol and ibuprofen and aspirin and Tylenol, and my physical therapy is excruciating. I have acquaintances in other states who said, why don't you take medical marijuana? I had my surgery 2 weeks ago, and I'm walking and doing fine. And we have medical marijuana in the state, and I would like you to expand the categories that the doctors in the state, my doctor said, if I could prescribe it for you, you're a prime candidate, but I can't. And I haven't smuggled it in from other states, but it's tempting. Thank you.
Okay, let me come over this way. Is there someone who wants to address the question of medical marijuana? Okay. When you use this wireless mic, keep it close. It's not the world's best.
I'll do the best I can. A strong proponent of medical marijuana when it first came out, and we made a rational decision in the state to move forward very conservatively with the program. So as you know, the first year, I believe there were 10 diagnoses that qualified for it, and now we've expanded it to 20, I believe. That was last year, I believe, and I think that's the procedure. We saw other states do this, and some things ran well and some things didn't run well, and we made a conscious decision to roll this program out every year, expand it little by little, and I think it's going to expand to more diagnoses as we go. And of course, there is a discussion about legalization this year. We'll see where that goes.
Coming over here.
I'm going to speak in Spanish because I feel a little bit more comfortable. I'm not that good at it, but it's for Bobby Sánchez. Bobby, yo vengo de una tercera generación de maestros. Mi mamá fue maestra, mi abuela fue maestra y la mamá de mi abuela fue maestra. Y estoy muy preocupada en cuanto a la educación para la comunidad low income, que es la que primeramente tiende a caer en vicios, empezando por los doctores. Se está abusando de la prescripción y en la comunidad latina también. Y eso los hace desertar escuelas y los guía en otras áreas fuera de la educación. ¿Cuál es el plan que hay para que la marihuana no sea el primer causante de la nueva generación que empieza a subir para que caigan? Porque yo entiendo que la marihuana es medicinal si se usan los componentes sabiamente, pero ya cuando la marihuana se fuma y se usa en otra forma, ya eso yo no lo encuentro medicinal. ¿Qué piensa usted hacer para que en la comunidad educacional, en las escuelas, se empiece la pequeña generación que está subiendo información para que no caigan?
May we have a little translation, please, and then we'd like to hear what you have to say.
Yeah, she was telling me that she's from a third generation of teaching within, teachers with her family. And her question is basically on medical marijuana and also the legalization of marijuana and how, moving forward, teaching children how to not fall into that, to be addictive to these, to marijuana in general. What are we going to do to teach them not to do that in the school systems? And well, I mean, right now, as far as I know, teachers or school systems don't allow substances in the schools, and I'm sure that they, and in some occasions, they do talk to the kids about it. I think that can be expanded. I think some of the family resource centers and some of the health centers in the schools can also be helpful. In regards to marijuana itself, the legalization of it, I know that there's a lot of talk about legalizing marijuana this year, and there has been talk in the past. Me personally, I have a lot of questions still because there's a lot of reports coming out from Colorado, and particularly about what she's touching up on, child development and issues within the school system. So, still, there's a lot of questions to be asked, and the other big question too in regards to legalization is once you legalize marijuana, what happens to those individuals who have served time and have felonies? What do we do about them? Do we expunge their records? Will the federal government allow us to do that? I mean, there's so many questions still about legalization.
And how can you tell us, our children, don't use drugs, don't use marijuana when you legalize it?
Right.
How can we know?
The same way we say don't drink.
I'm sorry. Thank you. The same way we say don't drink, that's how we do it. And the same way we say don't smoke cigarettes, both of which, by the way, are harder for kids to get than marijuana. And I think there's something else we have to do if we're going to be teaching our kids, and that's like get real. And tell them not just wait. Tell them not just it's bad, wait. But talk about how it's bad and why. And here's a stat I wish every kid and parent knew. If you don't use an intoxicant before you are 18 years old, whether that's smoking cigarettes or drinking or marijuana or a pill, if you don't do that before you're 18 years old, your chances of never having a substance abuse problem are over 90%. I'm sorry, that's what the people in the industry say.
Okay, let's hold it down.
In the first place, because alcohol has been proven is bad, people get addicted. That costs
Yeah.
money from the insurances. That's like a big burden. Drugs is the same thing.
Okay,
Is the
let's see if we
proposal
can
that
pass
should
it down
alcohol?
our panel, and do any of the other panelists have a comment they want to make on this?
I'll try to stay. Hello? Okay. I'll try to stay away from right or wrong, pro or con on this issue. But historically in Connecticut, we've had a good track record on when we got tobacco settlement money, we put a lot of that money into education and prevention. When we have other issues, opioid money comes in, that money needs to go into prevention. And theoretically, one of the thoughts about legalization of marijuana is that we'll tax it and get revenue. And absolutely, if that happens, I'm not saying if I'm for or against it, but if that happens, some of that money needs to go into education and prevention to make sure we don't end up with a problem. Gambling, revenue from that needs to go to education and prevention. I'm not saying it's a cure-all. I'm just saying we need to keep up the record of we know there's some potential harm in all these things that we move into, but we have to go into it with our eyes wide open and understand that some of this stuff are especially affecting our children. There needs to be education, and there needs to be an education component to protect them.
Let me move on to another topic, because we try to cover a lot of things, and you can talk to them after the meeting. I hope that they will stay around. Tolls, they are being suggested, they are being looked at. Do you support tolls? And if so, should the fees be restricted to commercial vehicles only? And who would like to begin on this one? Hey, Rick, you have a microphone in your hand.
Tolls is going to be one of our more difficult issues to cover in this state. And if you there's a lot of talk, and there's a lot of knee-jerk reaction of people who don't like tolls. And the reality is nobody likes tolls. Even the proponents don't like tolls. You know, I didn't want to have surgery on my knee, but I had to have surgery on my knee because it wasn't working. The same situation with tolls. We have a problem with transportation funding. We're not getting funding from the federal government anymore, and our gas tax is not creating the revenue we need to keep our roads and bridges safe, let alone unclogged. So our issue with tolls is we have to create a mechanism to pay for the roads and bridges and their upkeep. And we can either A, continue to raise the gas tax, which will disproportionately affect the residents of this state. We will bear that burden. Or we can do what every state around us has done, which is put in a toll system. Massachusetts, just from the Mass Pike alone, takes in almost $1 billion. And that money goes directly back into that highway, in that corridor. And it helps them balance their budget, helps them keep the roads safe, plowed, et cetera. And Rhode Island has one toll currently, the Newport Bridge. They bring in, I think, $200 million from that one bridge alone. And that's from tourists and people out of state that use that bridge. So as part of their transportation infrastructure is covered by out-of-state people. And that's what this process is. We don't know what we're going to do with tolls yet. Stop thinking that everyone knows where they're going to be or how many they're going to be. But we're looking into a way for all the people that drive through this state, from New York to Boston, that the out-of-staters pick up at least a portion of our infrastructure needs. And that is the reason why we are discussing tolls.
Any other opinions on the panel on tolls?
And the other issues remain that it may be somewhat regressive for people, and by that I mean if it costs you $20 a week, that's $1,000 a year. If you make $30,000 a year, that $1,000 a year to get to work is a big issue for you, more than someone who makes, say, $200,000 a year. The issue, Governor Lamont has said he's wanted to have the tolls on trucks, and we're still waiting to hear the end result of the lawsuit in Rhode Island where the Trucking Association has sued because they're trying to toll just trucks, and whether or not that stands up in court remains to be seen. A final nuance tends to be the cost per mile. We got different figures from former Commissioner Redeker, initially when it was presented to us, at least to our caucus, they talked about 10 cents per mile. For example, the Mass Pike is about 3.9 or 4 cents a mile, and going to peak congestive tolling up to close to 20 cents a mile, and said that was going to bring in the $1 to $2 billion range. Then when he testified at the bond commission hearing late in the year for the $10 million for the study that the governor really wanted to ask for, he said that 3.9 cents per mile would bring in $1 billion a year. So I'm not completely clear on the exact numbers, so I think the numbers remain to be seen. And the final argument is that there's a number of people in Hartford that feel that if we realign our bonding priorities between our general bond obligations and our transportation bonds, we'd have enough money to take care of things, not to do all the things that we want to do, but the things that we need to do. So as Representative Loeb said, it'll be a vigorous discussion with a number of those issues in play, the pros and cons.
Okay, thank you. Peggy, I'll bring you a mic, please.
Yes, hi. I want to ask the panel something. I went shopping with my niece. She's 12 years old. I'm going to tell you the store. We went to Dollar General, and she was going on a trip, so she wanted to buy some snacks. I was shocked. Acrylamide, which is known in the state of California to cause cancer, birth defects, reproductive harm. I went to Sears, bought her what do you call that bag that you put your knapsack? Chemicals in that. I made her put them back. I was just wondering, who do we contact and where does that fall under when you allow what's good for California is good for Connecticut. If it's not allowed in California, it should not be allowed in Connecticut. Acrylamide. Where do we go to stop it?
Here we go. I appreciate your concern and your question. Actually, we do and have taken steps in the state to inform consumers about the chemicals that may be in some of the materials that come into our state. I know in the past I've sponsored legislation regarding chemicals of high concern to get consumers to understand. About 2 years ago, the Department of Public Health, Department of Consumer Protection, and I think it was the Department of Environmental Protection, which is now DEEP, I think it's Energy and Environmental Protection, came up with what I would designate a memorandum of understanding. And in that, they actually started to publish some of these chemicals so consumers are aware. We haven't taken steps in the state to ban these particular chemicals. It is a very complicated issue, mainly because the Food and Drug Administration in Washington, D.C. Has been hesitant to issue any statements or bans, outright bans on some of these particular chemicals. But I remember in the past that we also banned certain chemicals that were being used in infant mattresses, changing tables, and of course you know very well about BHA and banning that in products that are used in, particularly in infant feeding in bottles and so forth. So there have been some advances, if you will, and mainly consumer awareness. There's also an entity out of the UConn Medical Center. They're based there. Oh, darn, I'm trying to pull it out of my memory, but they do deal specifically, they're a consumer group that deals with these kinds of chemicals. I know that before I left Public Health Committee that there would be interest again in banning certain flame retardants in clothing, as well as, and I know we've banned it in children's pajamas and so forth, as you know what happened there in the background. But also flame retardants that are used in sofas and other areas that people sit on and utilize. So there is consumer awareness. The state has stepped up and said, voluntarily stepped up and said, this is what we should do. And there are experts employed by the state. I know the Department of Public Health has an individual who works in this area, has for the last 2 decades that I'm aware of, has even published a book on being aware of these toxic chemicals. I would like to, as citizen Geritana, I would like to see more work done in this area. I share your concerns, and just so you know, I know our state has been interested in this and promoting awareness. Thank you.
I would just add, not to kick it away, but I think it's better approached on the federal level. And why is that? Because we can ban it here, but people do a lot of their shopping on the internet. So if it's not banned nationally, people can bring it across state lines, people can order it over the internet, and it ends up here anyway. And unless it's got the original label on it, you don't know what's in it. So, and when multiple states put in multiple laws, it creates a whole hodgepodge and creates confusion. So I think it's something in general. There may be very specific issues where it's better handled at a state level, but I think in general it's probably better handled on a federal level, so that you're not thinking that you're safe and things are coming across state lines that you're not aware contain a chemical that's banned in this state.
Carmelo Rodriguez, and I'm here on behalf of the Chaplains Community Faith Nubrit Latino Coalition. First of all, I'd just like congratulate former Senator new position. Thank you for the years that you served our community. Also, we are so proud of Robert Sanchez and the new positions. I don't think I might need this. But today, I'm here because the community of faith, as many are here today, they came with me today. 2 of the main issues there we facing in the community, especially among the Latinos, which our great concern is education, the proper funding, and the proper service out there. But I have to go back into the marijuana area. First of all, I also would like to congratulate the League of Women Voters for hosting this. It's very important and very informative. January 10th, the Nubrit Latino Coalition and the National Hispanic Christian Leadership Conference came together at the police station with representatives from the police department, Board of Education. We had the superintendent of school and 2 additional board members. We had 3 aldermen, and we had from the community faith coming together. And what we all came out of that meeting was that we have a great concern that the governor said that will be the priority, was to legalize marijuana just for the reason for financial reasons, just for a budget, to fix the budget. I know that my generation was tainted based of lack of family structure. And what we have seen now, we have a fatherless generation. We have a generation that is oppressed and depressed. Opiates, we see a large quantity of delinquency among juvenile. That is the result of the years of neglect with the family. Now, for years, we always told our community, dile no a las drogas, say no to drugs. And now the state wants to be the drug dealer of the community. I sat down for 20 years in the Department of Correction, went with court with many inmates, where the judge and the prosecutor told the inmate to tell the family that it was their fault for hurting the family, for selling marijuana, for dealing for marijuana, for the hurt and pain. Now we're going back against that. So I'm asking first, how many representatives are here are in favor of legalizing marijuana, first of all? And secondly, if you do, I agree with Representative Robert Sanchez that we will have to go back into the prison system and apologize to these families and to these inmates for stealing time of their life for something that now you guys are going to legalize.
Thank you. Okay, if we can quiet the room so we can hear from people.
Thank you. I'll tackle that first, because when when Representative Sanchez talked about what are we going to do with people who have been convicted, the proposed bill that has been submitted by 40 legislators so far says that marijuana convictions will be expunged. They will be removed from people's record, period. So you're concerned about what do we do about? That's what we're going to do about, period. Personally, by the way, I don't care if we make a dime off of marijuana or not. It has been used as a way to oppress certain communities. How many times has a police officer said in court, I smelled marijuana and therefore I approached the suspect? Not because I saw any crime being committed, not because I had any reason to believe a crime was being committed, not because anybody had complained of a crime ever being committed related to this. I smelled marijuana, and that's enough to say, stop, where are you going? Empty your pockets, lean against the wall, everything. What marijuana is a gateway to the correction system, and we can change that.
Thank you. Do we have something which is not marijuana? Because we would like to cover a breadth of issues here, and I'm going to come over here.
Just quickly.
Going back to Bobby.
Well, as education chair, my responsibility is as well the children of the state of Connecticut. And I do have a cousin who lives in Colorado, who's been there for the past 20 years, who is a preschool teacher, and she has concerns. And so I'm still waiting to hear more about these reports that are coming in about children coming in with more special needs. And I'm not saying that it's due to marijuana. What I'm saying is that she's saying that it may be due to some use of marijuana. So these are things I need to look into more before I can make a decision. I'm not saying that I'm against it, and I'm not saying I'm for it at this point. But when I vote on something up there, I want to have all the information in front of me before I make a decision.
Excuse me. Next question, please. Yes.
Yeah, I'm sorry. I can't really get up. I'm still suffering pain from 2 nearly fatal accidents, 2013 and 2014. I was on opiates for about a year, but that's another story. I took myself off. I have a question, yes or no question. Are there state awards for ideas or suggestions or plans that save the state money? So all I ever hear about is throwing more money at problems. I never hear people talking about saving money. And I have a couple of ideas that I'd like to share with you.
I just want to say, in the work that I have done in the legislature, we have saved money, for instance, in Medicaid. We actually reduced Medicaid costs by almost 6% in the state. Most people don't hear about that, but the work in Medicaid, and this is very much coupled with the work that I hope to be doing in the Office of Health Strategy, and that is cost containment, but still delivering a value. With Medicaid, what we did is we said the system that we have currently in the state is an expensive one, and the outcomes, the health outcomes, weren't that good. So what we did, I don't know what's going on there. What we did with Medicaid, for an example, is say, let's come up with a system that will provide better health care. And so we did away with the managed care organizations, the insurance companies that manage the care, which was very expensive. And we brought in what we call administrative services only, those entities that oversee our Medicaid program in terms of billing, but they don't actually have don't make those managed care decisions. But we did couple that with saying, okay, we want to know what the outcomes are going to be. This is why data is so important, and this is why tracking it is so important, because if you don't know what your health care costs, you're not going to know whether you're delivering good health care. And so I just want to say, with the example of Medicaid, we actually brought the cost of Medicaid. We're the only state in the country that has brought Medicaid costs down and given better quality health care. So I just want you to know that. It's something that I'm excited about and want to continue doing in my new role. Thank you.
Hey, if we can, an actual award you're asking about. Okay.
Well, in regards to saving money, another area that we need to look into is redundant services. And regionalization is a good way to go as well. But we know that in some cities, you may have certain amounts of organizations or agencies that do the same thing. And so why can't we do a combination of that in order to save some dollars? So that's one area I think that we need to look into. The other thing is some wasteful spending. I think 2 years ago, I had a group of correction officers that came to see me, and they were pointing out to a number of vehicles that were purchased by the state, and the vehicles were just sitting there. How much was spent on the vehicles? Something like $300,000 to $400,000. So why buy them if you don't need them? So, I mean, there's a lot of areas that we can look into, and I know the governor is going to have his hands full in looking into different departments and how they can save money. And I'm eager to hear some of your ideas that you said you brought with you.
Sir, the answer is no.
Okay, thank you. If a person that was using state services was able to lessen, say, I'll give you an example. Say I'm using $1,000. The state's spending $1,000 to help me with certain things, and I find that I can help somebody in my family or a friend or neighbor, and they can do that, and I can save the state that $1,000. Why wouldn't it be a good thing to award anyone that's getting state services part of what they were getting if they save the state money? In other words, if I'm getting $1,000 from the state and suddenly the state is not paying that $1,000 to me, why wouldn't it be a good thing to have the state pay me $500 or $200?
Okay.
I wonder how many taxpayers would like to pay somebody for not getting services. I wonder how many taxpayers are out there right now already making the decision, I know I qualify for something, but I'm okay. I'm just fine. I'm not going to have that money spent on me or spend it myself. That's why. Not going to happen. People should not be using more services than they need. And if you can find a way to not use services and save money, congratulations on being here. That's what we do. We don't give rewards for it. Once upon a time, there was a program for that for state employees. I mean, going way back before I was elected, back when Norwich Hospital was open, and somebody showed we could save a fortune by having storm windows. That program's gone. It was eventually replaced with the suggestion box that doesn't work, and because eventually you run out of ways to save money. And by the way, as a nurse who works for the state, I was there when Roland got rid of a huge percentage of our cars, and I saw how many fewer people were being able to get transportation they needed to get to the doctor, to get to court, to get to their next appointment for whatever it is. The fact that a car sits empty and unused for 20 hours out of a day does not at all decrease the need to assist some people with their transportation needs. To say that we want to make sure that inspectors get out somewhere and it's so important and they be able to do it in any weather, we'll even give them a state car to do it. You know? So that's that.
I'm going to ask.
Is either where the state is operating at 100% efficiency, so there's no need for suggestions from anyone in the state as to find a way to save money, to do something creative that's never been done before, or there's nobody in the state smart enough that could offer a suggestion that's useful to the state of Connecticut that would save money.
Okay. No, sir. Sir, the question is, should somebody who stops using state services get to keep some of the money that was previously spent on them and put it in their pocket so that it will no longer be used for people who need those services? Yes, sir, that was your question. In terms of suggestions, there's not an elected politician at any level who isn't interested in hearing about making things better.
Okay, let me move on. The League of Women Voters, State of Connecticut, actually asked us to ask a couple of questions. So, Mariola?
This is for the legislators. How will you work to support the Citizens Election Program and the State Election Enforcement Commission that is tasked with administering the CEP?
I've taken the pledge. I support those programs. I bragged about what we've been able to do establishing them. It's one of the best things that's ever happened. I tell the story about when I was first elected and assigned to committees. One of the committees I was assigned to was the Energy and Technology Committee, and everybody in the Capitol building who asked me what committees I was on, when I said Energy and Technology, whether they were a Democrat or a Republican or a staff person or an elected official, the response was the same. Ooh, good money commission, good money appointment, good money committee. Because if you're on Energy and Technology, there's enough money in the energy business that you don't have to worry. People are going to be happy to contribute to your campaign. You will never not do something because you couldn't raise the money for it. That's gone as an incentive. As long as we have a citizens election program that's based on small donations to qualify, we no longer have to look at somebody and think, I have to listen to this person again tell me the same thing that I think is wrong, because after all, they're a major donor. My major donors, everybody here, our major donors are regular people in the towns we're elected from. Major becomes not a lot of money, but a lot of donors. I think the majority of the people in the legislature understand that and appreciate it. The attack is always going to be, we can't afford it. I think that that's probably one example where we save more than we spend. And when you talk about getting new people in and new blood and keeping the legislature open to everybody, that's one of the things that does it.
Hi, good morning.
Good morning.
No sé si Carmelo me pueda traducir o... Ok. En esta mañana para mí es un honor estar aquí con ustedes, ¿verdad? Apenas pues le estoy conociendo. Llegué hace un año de Puerto Rico, pero mi preocupación es esto que estamos exponiendo aquí, el uso de la marihuana recreativa. Hoy yo voy a ser la voz cantante de los latinos y de madre y abuela, que estoy aquí recién, como quien dice, llegada. Pienso en mi nieto, que es el que está creciendo, que es el futuro de nuestro país. Hoy ustedes pueden estar frente a nosotros, porque en un momento, digo nosotros porque fui a la urna a votar por cada uno de ustedes. Y hoy estamos aquí haciéndoles sentir la preocupación de nosotros como padres y como abuelos, que cuando nuestros hijos o nuestros nietos estén ya adultos nos puedan decir qué tú hiciste cuando estuviste frente a ellos, cómo lo expusiste y qué decisión ellos tomaron.
Okay, so she is a mother and a grandmother, and she has her grandchild with her present, and she's been here in Connecticut for the past year. She's from Puerto Rico, and I know her because I've had a number of talks with her, and Hurricane Maria is why she's here in the state of Connecticut, one of the displaced people of Puerto Rico. And so she's, again, concerned about recreational marijuana. And she said she did go to the polls and she voted for us. And she wants to know that if her public officials, what are they going to do in regards to the legalization of recreational marijuana? It's something that's concerning to her, just like it is concerning to many in the Latino community, and her as a mother and a grandmother. I think I've already said what I had to say in regard to that. I don't know if somebody else wants to.
I think my concerns dovetail with some of the things that Bobby mentioned. First, I think the biggest study that's out there from Dunedin, New Zealand, that looked at people exposed to marijuana over a 25-year period showed that those exposed between the ages of 15 to 25 had decreased IQ on IQ tests, decreased memory, cognition, and executive function. No one's going to do a prospective study, so this is what's called an observational trial. They looked at people in their lives and asked them, whether they were regular users or not users. So there's a lot of concern about that, and that was testified to in the last several sessions by Dr. D'Souza from Yale, who's researched marijuana over the past 25 to 30 years. There's a lot of concerns about the issue of DWI and DUI, how to ascertain whether someone is under the influence and functional, because as you know, it's in the system for a long time, so your testing may remain positive, and blood samples are difficult to obtain, and the levels of THC in the bloodstream don't correlate directly with the ability to function. The psychiatrists bring up two other issues. The substance abuse counselors and psychiatrists bring up two other issues, that it's not nearly as addictive as most of the other agents out there, nicotine, alcohol, cocaine, opioids, but there's about an 8 to 12% group of people that can become addicted to marijuana, the THC, and there's no clear-cut therapy. In addition, people who have the genetic predisposition to delusional disorders may be provoked or precipitated by exposure to marijuana, creating a significant medical issue for them. So I have a lot of concerns. My thoughts are be careful what we wish for, because I think although some people think it's a libertarian issue and thinks it's a free country and you should be able to do what you want. Some people want to do it for tax reasons. Some people want to do it because other states are doing it. Some people want to do it to expand the medical indications, but I think we already have that. And I think there's a lot of potential downside to it that we certainly need to consider very carefully before we legalize the substance.
Ladies and gentlemen, I think that our legislators are aware that there's a great deal of concern about marijuana, but we've spent a lot of time on that, and I would really like it if we would move away to other questions. We discussed that at last year's forum at length. They will be here afterwards, I hope to talk to. But let's see, we have education, we have taxes, we have environment, we have a whole slew of things that we could be talking about as well. So if we could, please, let's have some breadth of our discussion.
Thank you, Ann. I've been asked to ask the panel about aging in place legislation. There was a legislative task force led by Senator Prague, I believe, in 2013 that talked about steps, policies, incentives that could be taken to keep Connecticut residents who are getting older, not me, but most others, getting older, to be able to stay in their homes even if they may need some assistance, incentives for insurance companies. And the question is this on the radar screen in this session?
I would say from an appropriations point of view, I was on the Human Services Subcommittee, and I think maybe Peter was as well. Comes up all the time. Number one, because if people can age in place, it's much better quality of life for them and for their family. And from the state point of view, it saves tremendous money in terms of services that are more easily and more economically provided at home. So I haven't been on aging or other committees, so we've had little dribs and drabs of it come towards public health. A lot of it talked about from the money point of view and appropriations. We've got a couple bills this week that got referred out of public health to the aging committee. So, yeah, the short answer is it's yes, it's talked about, and I think the general prejudice of most people, since now we have a bunch of 20-year-olds up in the legislature, but most of us are getting older. So I think most people are in favor of aging in place in general.
I would like to say that one of the bad things that happened with our last budget was we got rid of the Department of Aging or a Commission on Aging. It had been eliminated once before, actually way back when Edith Prague was in charge of it. People fought forever to get it back, and after, I don't know how much more than a decade, we succeeded. And then along eventually came a budget that was so horrible, it was time to be cutting off limbs instead of looking for other ways to nourish ourselves for our needs. And that's one of the things that went. I'm just reminded that one of the things Edith Prague used to talk about is another New England state where if family members were able to get paid as caregivers, once it was decided this person qualifies for this much assistance. If you've got a family member who's able to do that, isn't that okay instead of hiring a stranger? You know, that's something that we should be spending more attention to be helping people to stay in place and to do well. Excuse me? Very good. Yeah. Another example of it working. Thank you.
I'm coming around the back here, actually. And Marie?
Thank you. I'm Marie Bichon. A lot of you know me. Most of you up there know me. I'm in the community, and a thing that people have been asking me is the Care for Kids issue. They want to know how you guys stand on it, what you think about it. If you can just answer a few things about that. Thank you.
Care for Kids, we need to expand it. I have been getting complaints from many students, full-time students, that want to continue in school and can't get the care for some of their children because they don't qualify for Care for Kids. At one point, I think about 10 years ago, Care for Kids did allow that, and then it just took it away. And it costs millions and millions of dollars, that we know. One of the bills that I put forward in my committee, and I was just talking about that yesterday, was to expand Care for Kids to students, full-time students going to 2-year and 4-year college. So I'm hoping that will get through. Unfortunately, though, it's going to be a big price tag. So it's something that I'll have to sit down with the Probes and Finance to see where we're going to get the money. The other thing with Care for Kids is that we need to increase the percentile, because we have more and more working families that want to qualify and for their children and can't. Another piece about Care for Kids is to expand it more for infant and toddler care. We have a huge need. Here in New Britain alone, it's about 90%. The agency that I work for right now has about 85 families on the wait list for infant toddler care. And we're not including the YWCA or the YMCAs. I'm sure they have a huge list as well. So there is a big need, but it's costly as well. Because when you do open up center-based classrooms for infants and toddlers, now you have a ratio that you have to follow. So you have one teacher for every 4 toddlers or so forth. And again, it's costly, and we don't pay our teachers enough as well. So there's not many people going into that field, and that's another issue that I want to tackle in higher ed about how we can make it. If we start paying these teachers a little, compensating them more and more people getting out of high school will probably be more in tune to go to school for early childhood education.
Okay. Peter and then Rick, or Rick and then Peter.
Closer than you. For those of you who are unaware and people on TV, Care for Kids is a state program that allows child care subsidies so people can go back to work. Obviously, the state runs best when more people are back at work. So a lot of us, when some of the draconian budgets over the last couple of years, when we had to cut everything, Care for Kids was cut or limited, and it damaged a lot of families. A lot of people had to leave work to go back to care for their kids. And I know, speaking for at least us here in the Democratic caucus, I don't remember what the other caucus's stance on it was, but when those cuts happened, that was among our highest priority. Those cuts had to be restored. The governor had proposed a couple times to cut back on that program, and we said, no, this puts people to work. People working is very important in this state. So it's always been among the highest of our priorities.
Short answer is the House Republican caucus has completely supported it, and myself and Representative Whit Betts, who's from the west end of Bristol, pushed it in both in appropriations from our point of view.
Thank you for the question. I'd like to make a couple points. That's an example of spending money smartly and something we ought to do right there. Another way I like to look at things is what do our country's allies, who are our economic competitors, do? And not one of our allies, who is our economic competitors, has such a lousy system for child care, following right through to education. When Representative Sanchez talks about what about the people who are going to college and their young parents? These are things that we, the richest state in the richest nation ever in the world, should be able to do when our allies and the people we say we're competing with economically are able to do it. I personally do not believe that we are so bad in this country that we can't do what other people do to help take care of each other and move us all forward. I think that's a horrible thing for people to be pushing, and we should fight it every time. Things get expensive. Lots of things are expensive, but we manage to pay them. There are ways.
Thank you.
Thank you. My name is Maya Tillman. I have a question, education environment, but education, particularly with regional school choice. And this is for anyone. How does this benefit New Britain community in the future? Not many residents in our town understand what regional school choice is, and many of our schools have closed down, particularly with the middle schools. It's a different time now, and we are faced with overcrowding. And my understanding from the regional school choice, it might be with lack of ignorance, but my understanding is that the children that are bused out, it costs more, and so that's taking resources away from our community.
Ooh, very hot topic. It's something that we discussed just last week, a group of us. It's a hot topic because we still have people coming in with magnets and charter schools asking for more funding. Some of them want to even be included in the ECS formula, which that's something that's not being done. ECS is the educational cost sharing grants that the good thing, yeah, that the state funds education. So almost every year something comes up where there's either a magnet or a charter that wants to be built in a community. There are some communities like Bridgeport and New Haven that do ask for these schools. The SDE, the State Department of Education, does approve their applications, but then it has to go through us, the legislature, to determine whether we give them the funding to rebuild those schools. I'm a strong proponent of public education. So I don't want to say too much in regards to charters and magnets because that discussion is going to continue up at the Capitol. But you're absolutely right. There's a big cost to some of our local Board of Eds transporting children outside of the district. And so those are ongoing discussions about how we're going to tackle that issue. And it's a costly one. So if a child is leaving our public school system to go into a regional choice school, it's about anywhere from $7,000 to $8,000, I think, per child in that area. And it's that local Board of Ed that has to pay that. But the local Board of Ed does still get the ECS funding for that child, and usually it's a little higher than what that $8,000 cost is. So it's a really complicated issue, but it's something that we're going to continue working on. And advocates like you would be very important to come up during public participation and voice your concerns so that other state legislators can hear what those concerns are.
Do we have any other comments on that question? Okay.
I'm so sorry. I mean, thank you for your time. I'm wondering, as a community member, how is regional choice benefiting New Britain residents?
I mean, there are some statistics out there, as into benefiting New Britain residents. There are a number of families in this city that have their kids go out. They would rather have their kids go into these regional choice schools. I guess, you know, with statistically, it's like I said, it's a really complicated issue. I would have to get into a deep conversation with you on that. And right now, there's so many other answers that I would have to give you. But I think that's something that, you know, there are some boards, local boards, and there are some study groups up at the state capitol that are talking about this issue. And I think maybe you should look into that and find out how you can get more information and how we can work together.
If it's complicated for the panel, then it's complicated for us as a community.
As with all complex questions, the answer boils down to, does it help us or hurt us?
Yes.
Well, in some cases it helps us, in some cases it hurts us.
Yeah.
But as someone, we've put out a lot of resources towards these magnet schools and charter schools, and at a bottom line, those resources were taken away from our public schools.
Yes.
So we can make the argument that if we had never done that and just pumped the money back into our public schools, would they have improved?
Possibly.
Possibly. And the answer, you're dead on. Possibly they would, possibly they wouldn't. There's a lot of pro and con, and we're not being evasive. There's just some yes, some no.
But for the future, because we're already in
But
it now.
now that we're starting to get
Yes, for the
years and
future.
years of data on
Yes.
how these schools are affecting us, now there's a move to understand, have they helped us, have they moved the education systems forward, or have they hurt? And that's where we can start to determine that now.
Okay, we have about 5 more minutes. If we have any new topics that have not been covered, I'd really love to hear them too. It's been a great discussion, guys. Thank you for your cooperation, your participation.
Hello, my name is Eric Valentin. Questions for Senator. You had a discussion about looking to medical information. I have PPMS, so I will not always remember everything. Little by little, my memory is diminishing. So every day I go in the app just so that I can become familiar with it, so that I don't forget how to use the app. So my question to you is there a time frame where you're able to look up the information online where everything is connected?
Thank you. That's exactly what the Office of Health Strategy wants to do, to make sure that everyone will get that information. So in your case, you would be able to look and see what's going on with you personally as a patient, what's going on in healthcare, where you need to find resources for yourself, health resources. This is exactly what our agency wants to do and has been working on and has helped already, even though it's only been in existence for about 6 months. And it's something that I want to do and make sure that not only do we focus on it, but that we expand this so that everyone, every consumer, every patient, every person in this state can get that kind of information.
And certainly the big concern, though, it would be very helpful in terms of providing care across different entities and different providers. The biggest concern is the security of your data, since big agencies in Washington, D.C. that spend their full time protecting their data get hacked. People are very concerned about privacy of their data. And as an aside, I would point to, I've been I've been in the healthcare system as a patient 3 or 4 times the last few weeks, and everybody handed me a form that wanted my Social Security number. Don't put your Social Security numbers on forms that they're like old forms from 30 years ago that keep getting reprinted. They don't need your Social Security number, which is why the Social Security cards have all changed, or changing from Social Security numbers to other numbers aren't, so you don't lose that data.
Obviously, there's big concerns about security, but one of the protocols that has been very successful is Bitcoin. I'm sure you've heard about blockchain protocols. And blockchain protocols are being looked at as a way to secure health information because the interaction is between the person who is, well, with Bitcoin, with selling, and the person who is buying. How can we adapt that kind of security protocol and that particular protocol to the sharing of healthcare information? So actually what Representative Pettit brought up is a very valid concern, but one that is being addressed.
Let me also add in there a question on net neutrality. As we know, the federal government has been rolling back net neutrality. Some states have been passing laws to protect net neutrality. The League of Women Voters is quite concerned about net neutrality. What proposals will you bring to this year's legislature?
Thank you very much. I first learned about net neutrality 12 years ago when Ned Lamont was running for Senate. He's the one who taught me about it. It's one of the things I talked about when he was running for governor was, at last, we will have somebody running for governor who understands the issue of net neutrality. I thought we'd have to wait until we were electing teenagers to be governor before we had somebody who understood net neutrality. Thank God for gravity, or that puddle could be anywhere. But it is an issue. For those who aren't familiar with it, it's right now, and ideally the internet works the same for all of us. The question is, should the company that's controlling your access to the internet be able to treat you differently from that person or that company over there? Should we have slower speeds if we're using one service and than if we're using another? Neutrality is exactly what it sounds like. Everybody will be treated the same. The internet is more and more part of our lives and our future. This is one of those issues where, are we going to have two Americas, or are we going to be one America?
Any thoughts about what the state legislature might do about it?
It is specifically one of the issues that we are looking at in the Energy and Technology Committee. And I can't, and no, I'm not comfortable actually predicting where we're going to end up or where the biggest focus of the fight will be. It's too early in the process right now for that. But I have heart that we have more understanding of net neutrality in our government now than we ever have before. It's a good thing.
Okay, thank you. We're coming up on 11:45, and I think it's probably time that we close up this year's legislative breakfast and leave you a little time to talk informally. And if there's any food back there, of course, you're welcome to it. First of all, audience, your questions are wonderful. You bring to everybody an awareness of what the things are that worry us all so much. Yeah, marijuana's a toughie. It's got a lot of things on a lot of different sides. I'm sure we'll keep hearing from it. Ron, I see your hand up. All right, it's got 1 minute left before 11:15. We'll do this because you were head of NAACP and represent a large community here. So.
I was late, and I'm sorry for being late, but I'm glad for this opportunity. I have one question for you to ponder over. If you could answer it, I really would appreciate it. And that's the rise of hate crime in Connecticut. Not in the nation, but in Connecticut. And what are we doing about it? I know there's a advisory board on the state level that's supposed to meet semi-annually, that's supposed to educate all the communities and different things we could do to live more comfortably with each other. Just the other day in Berlin, hate crime. The guy should have been put into jail, but he wasn't. In Southington, a couple weeks ago, hate crime, all on the internet, making people afraid to go get gas because of who they are. What are we going to do about it? It's rising, and it's not only against the black community, it's against many communities. What are we going to do about it? This is America.
Ladies, gentlemen, any responses?
I think it's going to be taught in school.
Yeah, thank you for that question. I'm trying not to get overtly political here on a national level, but the reality of the situation is over the last couple of years, things are definitely getting worse. I don't think there's a person in this room who doesn't think things are getting worse. And stuff that was absolutely unacceptable 5-10 years ago are now becoming commonplace. And that's how it happens, little by little. And what we have to do is we have to stop taking it as this is normal now. It's not normal now. We need to be outraged. We need to absolutely, positively be outraged. What was said in Berlin was insanely crazy. And it cannot happen. That cannot be normal to be said. People can't be comfortable to be able to say something that hateful in public. I mean, it's about killing people. And it's not, and it was from a prominent member of the community. It's not okay. It can't be the last page of the newspaper. It's got to be the front page like it was, and people need to talk about it and say that it's unacceptable. It is not okay to hate people because of who they are. It is not okay to advocate violence towards a group of people. It's not going to be okay. We spent 50 years getting better and better and better, and now we spent a couple years getting worse. It's got to stop, and that's it.
Okay, thank you, ladies, gentlemen. Well, we've discussed a lot of different issues, actually, beginning with the opioid crisis and how physicians handle it, funding for our community colleges and education. We've talked about marijuana on many sides of it, legalization, recreational, medical effects of it, positive and negative criminal effects of it. The discussion goes on and on. I guess that's what led us to run a forum just on marijuana last year, because the concern is enormous and the issue is complex. We've talked about tolls and about other funding issues to our state, because we desperately need funds in order to bring forth the programs that we want to sponsor. We've talked about chemicals and keeping them out of our everyday items and foods. We've talked about saving money. How on earth can the state save some money? How can we reward people who come out with ideas? We've talked about medical data and protecting medical data. We've talked about child care and early childhood issues, payment for teachers, changing the way we work with our early childhood staff. We've talked about net neutrality, and we finished with hate crimes. What a world we're in nowadays. It can be made better if we all participate, and that's what the League of Women Voters is hoping we will all do together, and together we will bring our state of Connecticut to a better place. So thank you for coming. Thank you to our panelists. Thank you to everyone else. Good night.
Got your margin.